to be here tonight to speak about a condition that statistically affects many of you in this room here right now. That condition is varicose veins. I'm also glad to describe non-surgical vein treatments. The majority of vein problems today do not require surgery. For the most part, they've been replaced by endovenous ablation procedures. The term endovenous just means from within the vein. Ablation means the destruction of. So the new vein treatments focus on destroying the vein from within rather than cutting and surgically removing varicose veins. Since I only have a few more minutes to speak, I'm going to focus on just one particular endovenous procedure. It's one of the more popular procedures called chemical ablation of varicose veins. It's also known as microphone sclerotherapy or ultrasound-guided foam sclerotherapy. So for those of you who don't know, varicose veins, the term refers to any enlarged, abnormally dilated veins. Technically, it refers to abnormal veins of any size, but common language refers to the small veins as spider veins and the larger bulging veins as varicose veins. I'm going to focus on the larger varicose vein treatments tonight. I just put this image up to remind you that varicose veins are diseased, unhealthy veins. Just to review, the veins carry the blood from the rest of the body back to the heart. So the blood is traveling in the direction of its gravity. The only thing that's keeping the blood from flowing back down and pulling out the ankles are a bunch of permanent valves in the veins of the legs. When these valves become damaged or weak, they leak, and you get a backflow of blood. In the medical field, referred to as venous reflux. That backflow of blood causes the vein to become enlarged, tortuous, like the vein on the right side, protuberant, and sometimes painful after standing for long periods of time. Can also give branch to smaller vein problems, such as spider veins. So varicose veins can cause symptoms, such as swelling of the feet, ankles, and legs. It can also cause pain, aching, heaviness, and fatigue. That's worse at the end of the day. So a lot of people who are aware of their vein problems tend to have standard occupations, such as flight attendants, servers, teachers, health professionals who notice that their legs tend to feel achy and tired at the end of the day. Over time, you can develop skin changes, such as skin thickening and darkening, even venous eczema around the ankles, as well as leg ulcerations. Some varicose veins can even burst. But many people don't have any symptoms at all. So people seek treatment for both cosmetic and medical reasons. The first step in treating vein problems depends on an accurate diagnosis. Vein problems can sometimes indicate an underlying medical condition. For that reason, you want to see someone who specializes in vein problems, is very familiar with the vascular structures of the legs. In addition to physician consultation, it's necessary to do a duplex ultrasound examination of the leg veins. Many vein problems are not visible to the naked eye, so the duplex ultrasound examination is a painless way to visualize the vascular structures that are not visible to the naked eye and lie beneath the muscles, and also to create an anatomical roadmap that will help us identify which veins we want to treat. So microfoam sclerotherapy treatment of varicose veins. Sclerotherapy has been around since the 1940s for the treatment of small veins. But what's new, or newer I should say, is the development of microfoam solution that's used to treat any sized veins. It was introduced in Spain by Juan Cabrera in 1993, and more recently in the year 2000 by Dr. John Bergen, my mentor in the United States. The procedure is based on injecting a solution, and again, what's different about the foam sclerotherapy as opposed to liquid sclerotherapy is that it's a foam solution. It's painless. The only thing that a patient will feel is a quick needle stick, but the solution itself is painless. From one or two needles, two sides, the solution can be manually guided to nearby branching veins. It's done under ultrasound guidance. The foam, unlike liquid, displaces the blood, comes into full contact with the lining of the vein wall. Once the foam comes into contact with the vein wall, the endothelial cells that line the vein become irritated. Your body then recognizes that this is a damaged vein, and it causes a response that causes the vein to scar shut. After that time, the vein is essentially not working. It's like a dead vein, and it's absorbed by the body. I actually have a great animation that demonstrates this better than I can describe, but unfortunately it's not working. The procedure is office-based. No anesthesia is used because, not even local anesthesia, because the solution is painless. So the only pain the patient feels, again, is just a quick needle stick. There's no downtime. The toughest part of the treatment is just wearing the compression stockings, which is the essential part of treatment of the large varicose veins. Most people need more than one treatment session, usually 2 to 3. Patients report that their legs feel better, usually within a couple of weeks, but it takes several weeks for the veins to completely vanish. So this is an example of a patient who did not have surgery, no incisions, just multiple treatments of foam sclerotherapy. I have more pictures that my staff advised me that these are unpleasant to look at. So overall, microfoam sclerotherapy can also be used for other vein problems, such as venous malformations, venous leg ulcers, and smaller vein problems that don't respond to liquid. So, in conclusion, microfoam sclerotherapy is a great alternative to surgery and the other intravenous procedures. It's proven to be a safe and effective treatment method. Sorry, I'm taking my last slide to work. But overall, you can always get rid of varicose veins regardless of size. It's just a matter of time and multiple treatment sessions. But it does replace surgery, so there's no need for incisions or cutting. So this is a lot of information in a short period of time, so I'm happy to answer any questions after this presentation. And enjoy the rest of your night. Thank you.